I'll do record. Okay. And I also will capture the chat when we're done, and the recording and the chat, I'll send out links to those things on the listserv, and they'll also be posted on the Spokane Homeless Coalition website. So it's available if you want to come back and look at it again and again and again, or refer somebody else to it. My name is Barry Barfield. I am on the leadership team of the Spokane Homeless Coalition, along with some other folks. Robert Lipman is usually the wonderful person you see for chairing this meeting, but he is on duty at work today, and he's in the meeting, but he's just listening. He's has to do his job. So you got me. I'm going to recommend that if any of you want to use the chat and basically kind of introduce yourself, which is what I've been doing before people came in at 9:30. And if you're interested and you want to connect, this is one way to do it in Zoom land. Put your name, your contact info, where you work, what you do. My guess is there'll be people who'll see that and go, whoa, I would love to connect with so-and-so because I could use your service, or I can somehow connect that way. So that's one way to do it. Let's see. Our agenda today, the folks we have, Jenn Cerecedes, who's the new program director at Community Housing and Human Services for the city of Spokane. We got Ben Stuckart with Continuum of Care, Kira Lewis, Spokane Regional Health District, Karen Stratton, Spokane City Council District 3, Rayan Orbom, who works with the Washington State Healthcare Authority. I have not had the opportunity, because I just got put in this a few minutes ago, to talk to those folks and kind of work out an order. So I'm just going to open it up. Is there any of those names that I just mentioned who we have on our agenda who need to go sooner rather than later? Otherwise, I'll just go down the list the way I have them. Anybody, any presenter out there who wants a different order for your convenience?
Barry, this is Rayan from the Healthcare Authority.
Yes.
I would love to go sooner rather than later, but I can make anything work if someone else needs to go soon too.
Well, if nobody speaks up, Rayan, I'm going to make you number one. So anybody else want to speak up? No? Okay.
Yeah, I would like to go next if possible, because I have to call clients.
And who is this?
Jeannie Robinson from Aging and Long-Term Care.
Oh, well, Jeannie, you're not on my agenda.
Okay.
Did you, at the very end of the meeting, or an hour from now, I open it up for announcements. But at this point, I'd rather not do that. So.
Okay.
All right. So I'm not hearing from Jenn, Ben, Kira, or Karen. So Rayan. And Robert is the person who invited you, so he knows more about you. So I can't really say much about you other than Rayan. Why don't you introduce yourself? Tell us what you do, and maybe let us know why Robert Lipman invited you to speak to us.
Of course, thank you. So some of you, oh, my camera, man. Some of you might know me. My old role was at Volunteers of America, and I oversaw the housing department. But I recently moved over to the Healthcare Authority, and that's kind of where this journey has begun with Robert and just trying to figure out how we can kind of connect resources. So this department that I'm in, excuse me, is under the DBHR, so Department of Behavioral Health and Recovery Services. And then I'm under, excuse me, the Healthcare Authority. So my role is literally to support any single agency or housing provider to do supportive housing. So anybody on the west side of the state, you're all mine. Sorry about your bad luck, but you're all mine. So I can do things, when I did permanent supportive housing, I didn't realize that this was actually a resource. And so that's why I just want to make sure that everybody knows that it exists, that it's available to you. I've never seen state funding come with free trainings. And so I'm completely free. So I do FCS trainings. supportive housing trainings, how to engage with folks. And then my job is, if the community or an agency has something that you're like, hey, actually as a community, we've seen, alcohol use increase dramatically. If I can't do the national contract, technical assistance agencies, and then they can do the training for us. So it's a pretty cool kind of department, and it's really ebb and flow based on your guys' needs. But the last person didn't have a really strong foothold in Spokane. So my priority is Spokane, making sure that we're, utilizing FCS the best and the most efficient way that we can. And then also just supporting agencies and anything that they want to do in terms of supporting folks. And then just so that you guys know, there's also my peer. She's not here today because she's in a meeting, but Dawn Miller is everything for supported employment on this side of the state as well. So you have a one-on-one contact. If just to help anybody understand, AmeriGroup is the one who, everybody submits their billing through. And then my department is the one that oversees that AmeriGroup contract. Just to kind of wrap it all into pieces. So I have my contact stuff in the chat. I'll put it in there again. But I would love to partner. I would love to work with any of you. And if you know anybody who wants to start doing supportive housing, or, has maybe applied, but has only really served 1 or 2 participants, I'm your gal. So please throw my name wherever you need it. And I'm happy to support. That also includes one-on-one training, which is super rare. So my job is to help you build capacity. So 2 weeks ago, I spent 5 hours with the staff at Passages, just training them on how to be a supportive housing provider. So please note, nothing's too small, nothing's too big. And I'm really excited to be here and to be a part of this group from this position. I really think that Washington State has a lot of resources that Spokane can utilize. So I'm hoping to facilitate that journey.
Okay, Rayan, thank you. You are a wonderful resource. And again, anybody who puts anything in the chat, I will capture the chat and I will send it out on the listserv probably within a day or 2. So if Rayan's information, if you can get off the chat today, great. If you don't, just know that it will be showing up eventually in your email box. Let's see. And if you have a question for Rayan, why don't you put that in the chat? And I don't see any at the moment for you, Rayan, but if any
It's Rayan.
Sorry, Rayan.
Barry.
Thank you. Thank you, Chris.
He's my old boss.
Rayan. And I asked Robert that even before the meeting how to pronounce it. And he said Rayan, but my brain, it didn't stick. So
it's literally anything that's remotely close. I swear I respond to, but thank you, Chris. And I did forget, Barry, I want to connect anybody who is an FCS provider. Please connect to me, because there's a new short-term subsidy coming out that is meant to help folks move into housing, and it's targeted at everybody who can't get through all the other short-term subsidies or the other subsidies. So please contact me. I'll send you the webinar. We'll do all that stuff. But there's some money coming down that's going to change the game for some folks. I want to make sure that you guys have access to that.
Ooh, that's good too. And Rayan, maybe if you want, like the things that you're telling me, this sounds like this is a really great resource. Maybe I'm going to ask you or I can follow up with this. Have you write up a blurb or something about all the things that you're suggesting and offering, and I can send that out on the listserv, because we have 1,300 people on the email chain. So right now, 100 people are hearing you. But if you want to get the word out even further, give me that information. And are you on the listserv, by the way?
I am.
Okay.
It's my personal, though, not my work.
Okay,
Yeah.
so then you can send it out if you wanted to.
Right on.
Okay, good.
Thank you. Thanks, guys.
All right. Thank you, Rayan. Next on my list, Jenn Cerecedes. You are the new director of the Community Housing and Human Services. Please introduce yourself and tell us about what you do and how we can support you and you can support us.
Thanks, Barry. Good morning, everybody. I'm Jenn Cerecedes, and I'm the new CHHS director. This is my 5th week on the job. So just really trying to wrap my arms around, kind of what's been happening, what's happening out in the community, what we have to work on going forward. Just a little bit of background about me. I worked for 10 years in homeless services. I was at SNAP. I was a direct case manager. I was the program operations manager. I served on the Homeless Coalition leadership team, I think in 2007. So I did that for about 10 years. And then I moved into the private sector, working for a forest products company here in Spokane in HR, purchasing, marketing. And then I saw this opportunity and I was lucky enough to get the chance to come work at the city, and I'm really excited to be here. I'm really excited and interested in learning more about everything that the community is doing to support homelessness and to help folks who are experiencing homelessness get out of it. I get all of the emails that come through, and I'm just in awe of all of the work that you all do. And it really takes all of us to do it, right? There's no one person that is going to be able to solve this on their own. I know a really big issue right now is our lack of a warming center here in Spokane during this cold weather. And I'd like to let you know that we are actively working on that. And I really hope to have some sort of an announcement soon about a location. As I'm sure many of you know, it's been really challenging to find a location that we can utilize for this. And we've been working really hard to get into compliance with the Spokane Municipal Code that requires that we do this, and also because we want to be doing this, right? We want to give people a safe, warm place to be in the winter, along with helping on a myriad of other issues, kind of in that long-term strategy of how do we as a community address homelessness. So that's just kind of me in a nutshell. I'm glad to answer any questions that anybody has, and thank you for having me here today.
Okay. And I'd suggest just putting the questions in the chat if you have them. I'll ask you, Jen, another thing that comes up often is I think most of the people on this Zoom are aware of the turnover of staff and personnel in your department. So why don't you give an update on kind of where that is, where you are in staffing?
Sure. So we still have quite a few positions left to fill. We are in the process of scheduling some interviews for some of those positions. There was a couple people that were hired on prior to me. So we are still operating a bit on a skeleton crew, but we have a really great team that's very dedicated, and we're getting the work done that needs to be done. But certainly if you're feeling like you're not getting your answers as quickly as you want, it's because we are a bit overloaded, and we're working really hard to remedy that. And to get up fully staffed. Unfortunately, as I'm sure many of you are aware, the labor market is very tight, and it's a very challenging process to get folks in the door, especially just through the processes that we have at the city with the civil service. You know, we have a very specific process that we have to go through. I have a question from, hopefully, is it Haley or Hallie? Birchinell, it says, has the city considered speaking with impacted individuals as well as providers to identify models that may be much more effective than a large shelter space? Yes, so we are regularly taking input, and please, reach out to me via email or call if you would like. We work really closely with the Built for Zero group, who is out in the community, and a lot of times they're bringing some of that feedback back to us. I think one of the challenges that we see if we're talking about an emergency warming shelter is that the cost to oversee multiple sites and the challenges of overseeing multiple sites can limit us a little bit, right? Versus one site where we're able to kind of have all of that oversight in one place. That doesn't mean that it's the right choice, and it doesn't mean that we shouldn't explore that. And I think that we have looked at some smaller site options as well. And we're really trying to work through how do we best get something that is up and running as quickly as possible in a model that's going to work for the community. And I would agree, having multiple locations means that likely there's going to be a shelter close to you versus, if you're on the other side of town and there's only one, it's going to be a ways to get there. So we're glad to speak to impacted individuals. We did do a survey at the Convention Center Warming Center to kind of talk to folks about their needs and how can we get people resourced, but we're always interested in continuing to have that dialogue and conversation. Jason Green has said, where is CHHS at with your getting correct shelter numbers out daily or even better real-time shelter data? Thank you, Jason. We've had a lot of help from the community on our shelter report, and I really appreciate the feedback. We're not robots, you know, we're human beings and we do make mistakes. So I appreciate when people have questions about that or concerns that the formulas that we're using in our report are not correct. And we have had some errors caught that way. And so thank you, and please continue to send those. Some of the feedback that I've gotten on the shelter report has been around, I think what I would term maybe more of a conversation around how do we choose to view and bucket availability, and how do we choose to view and bucket types of beds and types, like, is it low barrier or not low barrier, et cetera. So some of that we're working on developing a little bit more of like, here's our framework. And not everybody will agree with our framework, but at least if you know the framework that we're working in, then you can understand how we're choosing to calculate those beds. The other thing that I wanted to put out there is that we are getting data from shelter providers directly. So every day we have shelter providers who email us their numbers, and we put those numbers into that report. So that's where those numbers come from. They come directly from our shelter providers. We are working in conjunction with Spokane County on a dashboard where shelter providers would input their data directly into essentially a dashboard themselves, so it doesn't flow through us and we don't have to compile that information together. So I'm hoping in the next maybe month or so we can have something up and running. We had again, not our project, but the person who was building it had a job change, and so we're kind of working through some of those staffing issues as well. So that is my answer on, sorry, there's lots of questions, so I got to scroll back up. So that was Jason's question.
Right.
Heather Thomas.
No, that's okay. That one asked about the COC, and Ben Stuckart is next on our agenda.
Oh,
I think he would be best to answer that one.
Perfect, thank you. Hallie, I don't know if this is a question for me, I'm just looking. Steps.
Yeah. How can bring people with lived experience into the conversation? I think that's what Hallie's asking, that longer question.
And then an app that participants could have access to. So the dashboard that we're looking at is available on a mobile, so people could look at that, and we are working on seeing how we can make that more user friendly, because I think it's really been built from a provider or a funding perspective and not necessarily from a person seeking shelter perspective. So that's something we're working on.
Let me stop you there. Did you say that there is a dashboard available on a phone right now?
So there is a beta site that has been built that is working, and I know several providers have seen it and have weighed in on it. The person who built it actually took a new job, and so they're in the process of transitioning the ownership and administration of that site over to the county, and we're kind of working through some of those, but it is built. I think we just need a little bit of tweaks, and my main concern with it right now is making sure that we have the reporting capability to pull out historical data of that going forward.
I have the follow-up on that one, and it's not a gotcha question, but I know a lot of people want to know, do you have an estimated time? Because people have been waiting for that for a long time. Do you have an estimated time when it might be up and running?
I would like to say in a month. That might be pie in the sky. So in a month, if you don't see one, feel free to call me and say, Jen, you told me at a homeless coalition meeting that you would have this up in a month, and it's not. But I think it's reasonable considering that it's already built. Now, I will say that it will be an ongoing process of continuing to refine even this dashboard, right? Because it's not, it's a very complex system that we're trying to put into a very easily accessible dashboard, which comes with some challenges. So, but yes, I would like to think in about a month that we could have that.
Yeah, I think the rest of them, I don't think there's anything in particular for you. One of them asks, Eric Finch, is he still around? So why don't you explain, because Eric has been the face the last couple of meetings. Why don't you explain, where he is now?
Sure. So Eric actually has always been holding the job of the NHHS director, which oversees multiple divisions, including CHHS. So he of course was managing CHHS. So in effect, he was essentially doing 3 jobs, and I bow down to all of the work that he did prior to me coming on, because it has been a lot. So anything CHHS related, I oversee that, and then I roll up to Eric. So Eric is kind of more that strategy, planning, kind of big picture going forward, and I'm a little bit more, CHHS operations, certainly still involved in strategy and planning, but that's kind of our breakout with that.
Yes, so Eric is definitely a good contact for a lot of this stuff. And that's all I really see in the chat.
I
And
have a quick question, Barry, while I'm listening in here.
sure, Robert.
Yeah, Jen, you mentioned the structuring kind of a framework with those definitions regarding barrier status. I was curious as far as what consultation plays into that in establishing those parameters.
Are you talking about like what we consider low barrier?
Yes.
So I would say it's a combination of things. So there's kind of, I think, what you could look at as a working definition across all programs of what's considered low barrier, which is, that there are not requirements to entry. Things like you don't have to be sober, you don't have to have an ID card, you don't have to attend any kind of required classes or services. So I mean, I think there's kind of a working definition, and I'd like to have something more formal put down to kind of be able to talk through this in depth, because I know it's kind of a hot topic. I think that where we get into kind of there are some differences in how organizations choose to run the operations of their facilities, right? And they do have rules that are associated with conduct at their facilities. And I think that sometimes those rules can be seen as that is not a low barrier, because you do have these rules that might prevent somebody from coming in. But so we're kind of working off that higher level. Do they have these kind of real strict barriers to entry? I think that the nuance comes when you start talking about what are the true expectations to be in that facility. And then that's where we get into the philosophical discussion about, can we really call that low barrier or not? So I'm hoping that having that definition, whether you agree with the definition that we're choosing to call low barrier or not, at least we know what we are saying it is, so that when we're counting those beds, you know how we're choosing to kind of align our numbers, right, from a clarity standpoint.
Is that
Thank
good,
you.
Robert?
Yes, thank you.
Okay. There's probably more, but we have more folks on our agenda. I know Jen is very accessible. Just type in her name and City of Spokane. You'll get her email, you get her phone number. I know she'll be responsive. I've been working with her a lot. I'm on the CHHS board, and I find her very pleasant and agreeable and helpful and very busy. So thank you, Jen. Anything you want to say before we close, Jen? Any final words?
Thank you for all having me, and I look forward to continuing to collaborate with all of the members of our community who are working on this very serious and important issue.
Okay, thank you, Jen. Ben Stuckart, can you give us a report on the COC? And then there was that one question in the chat about why doesn't the COC have a standing shelter committee?
Hi, everybody. I'm going to get through a couple logistics, and then I'll end with kind of a broad thing on that question. So my name is Ben. I'm the chair of the Continuum of Care board. Just to review real quick, the Continuum of Care handles $4.3 million in HUD money and homeless prevention dollars that come through the Spokane region. It's a regional board that includes the city, the county, the valley. We're really glad to have Jenn on board. And just the quickest barrier is in 2015, though, the HUD ruled that we were going to switch to housing first, which would be a good thing if they gave more money. But what they did was said that COCs could no longer spend homeless prevention dollars on shelters. So what that did was throw all the shelter operation dollars either to the private sector or look to local governments to pick it up. But they didn't put any more money in the homeless prevention services. And so that's why we find ourselves here 6 years later, still struggling to figure out the shelter system. It's because of what the federal government did with their COC dollars. So, and shelter is a huge issue, but it's also, if we look back, starting in the 1970s, we deinstitutionalized mental health, and we also cut low-income housing dollars by 75%. So you can't figure that 30 years later, you're not going to have a homeless crisis if you cut 75% of housing dollars later. People are not going to have houses because people need low-income housing. That's how our system works. There's a position at the bottom of our parabola in our economic system. And so the city is in a pretty rough position financially on continuing to do that. Luckily, right now, though, I think the two most important things people could do is contact their elected representatives and get the ARPA money out the door. Between the city and the county, we have $181 million in ARPA funds. The city council has done a great job and allocated 14 million of that, and their largest allocation was to low-income housing. But if we think about that, that's 14 million out of 181 million that have been in the community since March of 2021. Now you can also, the second thing we should all be doing is contacting our state legislators. There's $1 billion in ARPA money at the state level. The push right now at the state level is to spend 500 million of that on housing and homeless services. And all of our 3rd, 6th, and 4th district representatives need to hear from everybody on this call. If everybody sent an email to your state representatives and said the most important thing that you can do with that $1 billion in ARPA funding at the state level is spend it on homelessness and on long-term housing solutions, we could make a difference right now. They'd all get bombarded with 99 emails. It's something we can all do right now. On logistics on the continuum of care, we have 4 board positions open right now that we're recruiting for. We need somebody from the K-12 education system. We need somebody from the business community, somebody from the law and justice system, and somebody from that is involved with temporary shelter. The application is available at spokanecity.org/COC. That's spokanecity.org/COC. We have 26 board members from a wide swath of the community, and we really need a lot of applications for these 4 board positions. Another update is we did last year, we talked about this before, we got the Youth Homeless Demonstration Program grant, which is $2 million over 2 years. It's 2-point-something million over 2 years. We just approved hiring a full-time coordinator for that position. That'll work alongside the Built for Zero and the ACI programs that currently exist. That coordinator should be hired within the next month. And so we'll have a full-time person working on that program and really planning for the future on what the best way to spend those $2 million is. And finally, it's just the COC has a retreat. Eric mentioned this in the chat on February 14th. And the reason the COC doesn't have a shelter subcommittee is because the COC doesn't fund any of the shelter system. And so you think about a homeless prevention organization like the COC that's responsible for a community 5-year plan, yet our system is very siloed. And the goal of this, all of the different public funders, so that includes the county board, the CHHS board, elected officials from the city, the county, have been invited to the COC's retreat on February 14th. The goal of that retreat is to come out of there with an agreement that all of the public funders, instead of being in little silos, and the COC over here having a 5-year plan that's not really a community 5-year plan because, well, quite frankly, we get taken out of conversations on the shelter system. But we know from cities that have successfully decreased their homeless population by over 50%, you have a community plan that is bought off on by all of the public funders,
Yep.
but then they go out to the private funders, and you have private funders in this community that want to help, and you gather them all and everybody agrees on one plan that's coordinated through the system, and you're making all your funding decisions based on that plan. Instead of a shelter conversation over here, and prevention services over here and a long-term housing solution over here, you're saying we're all playing from the same sheet of music. So I think the retreat and the next 6 months are going to be really important for the community, for us to come up with a community plan. With that, I'll be quiet because I know you got a lot on your agenda.
Oh, Ben, you're great. That I support everything you said. We need to get the community as a whole. We do wonderful things in our silos, but we really need to get some kind of umbrella agreement and moving forward together. And so I really hope that the retreat on the 14th can move that forward.
Yeah, and it's going to require all the partners to give up some power in
Right.
order to collectively make an impact. So just because one agency has 4 million and one agency has 6 million and another group has 3 million, you should pile all that together and go towards the exact same goals. And you're going to give up power as a board on that, but you've got to convince everybody, including the elected officials, not to be making decisions about a shelter system over here on their own, when we just need to be better about collaboration and coordination as an entire system. And that's the way we're all going to get something done. Otherwise, we're all just going to be trying to do little things over here and there and make a difference, but it's not going to work.
Okay. Thank you, Ben.
I have a quick question for Ben.
Go ahead, Robert.
While I'm listening in. Ben, what are the primary topics you think that will be covered in this agreement? And will this agreement take away from or add to the 5-year plan that's already in existence with the COC?
What it should do is actually supplement and update the 5-year plan. I'd really like, as people make agreements at the retreat, the public funders to have a 6-month process. We'll have small working groups on each part of the system, whether that's rapid rehousing, whether that's temporary shelter, transitional housing, permanent supportive housing. And then we need to be able to come up with numbers after 6 months that says an optimal system would have this many permanent supportive housing in it. And that's our goal. So instead of just saying we want more permanent supportive housing, we need to set a goal with numbers and say, this is how we're going to get there. So it's actually taking the 5-year plan and making it more specific in my mind. And then all the boards can use that as their template when they're making funding decisions. But it also has to come with an agreement that if you're making decisions on a shelter system, that doesn't just come out to the community in a press conference that the decision has been made. All those partners should be playing from the sheet of music that says what type of shelters we want, where we want them to be located near services, and then move towards that together as you make decisions.
And this is Heather from Stepping Stones Pediatric. Could you just walk us through what level of participation we're going to see from participants of the current homeless system and people that have graduated out of Spokane's homeless system at the retreat on 14th?
Yeah, we have youth and adults that have lived experience that'll be at the retreat. And I think the retreat will probably have about 50 to 60 people there. I'm hoping one of the things we're trying to do is have breakout sessions. I'm waiting for a master list so I can start calling and begging people that are doing things like rapid rehousing, permanent supportive housing, coordinated entry. There'll be breakout sessions with each of those parts of the system. And then we'll take signups at the retreat to work on the 6-month plan. And then we'll be reaching out to everybody in the community. And I hope to be back here asking people to sign up for working groups out of this group, out of the 100 people. And we'll also be reaching out to the listserv of 1,300 on who wants to work in those working groups as we move forward. So no decisions will be made. My hope is at the retreat, there's an agreement that we can move forward with a 6-month planning process, that if we arrive at a product we all agree on at the end, that it is accepted. And then the work would take place with everybody working in the system and on the streets over the next 6 months.
And Dale Breese, you have your hand up and you'd be a good person to follow up with that question.
Yeah, well, and I invite anyone right now, because the COC, I'm Dale Breese, by the way, I serve with Ben on the COC, and I represent the lived experience. And I invite any agency right now to go to the City of Spokane website, COC 5-year plan, and just review it with your constituents and your clients and such, and start prepping that gaps and the successes and narratives. And because we're updating that, that's this process over the next 6 months. And so don't, because that needs to be fed back. And if that includes promotion of collaboration, I think that is between these bodies that Ben was talking about, the funding, that would weigh a lot in getting us to a healthier regional plan. So, and I'll put my personal email in the chat because I will, if you want to feed me information to get back, I will be happy to do that. So thank you. Okay.
Thank you, Dale. I see, let's see, nothing else in the chat about Ben. 14th is the start. Okay. So, Ben, anything last to say before we move on? I'll take that as a no. Kara Lewis, Spokane Regional Health District. Can you give us a report? Tell us how we can get our community healthier.
Good morning. Yeah, I'm Kira. I am a nurse at the health district and I work in the communicable disease epidemiology department. And I'm on our congregate team, is what we call it, with several others of my colleagues on that team who have joined this call. 2 epidemiologists and our hepatitis C coordinator. And then I also do strategizing and some coordinating for testing in the community. In terms of an SRHD update, we are hiring for the homeless outreach coordinator position that Kylie held before. And so that position will be replaced, and we're in the process of interviews right now. And that individual will also be on the congregate team supporting shelters and homeless service providers. So for a COVID update, we have outbreaks in nearly all of our shelters. There are 4 smaller shelters at this time that aren't an outbreak, but they are what we call under investigation. So they have cases, but are not at the volume or that would be considered outbreak, or we aren't sure yet if the transmission happened in the shelters. So COVID has really spread through the community of people experiencing shelter homelessness and shelters quite significantly. I will say there are some shelters that have been really impacted in terms of number of cases, which is expected with Omicron. We've actually had several shelters that have had fairly low numbers and less transmission than we would have anticipated, which is a good sign. Right now, most shelters are doing some isolation on site, and that's due to just having numbers that exceed the capacity of the Salvation Army isolation facility. We are continuing to do testing in the shelters. We've had pretty significant supply chain constraints with rapid tests. So there was a time when we were limiting the testing that we were doing somewhat. That was, I think, less than a week. We are now back up to our normal testing protocol, which includes testing people who are symptomatic exposed, but also doing surveillance testing. So general population testing within the shelters. SRHD and some community partners, School of Nursing, School of Pharmacy, are doing vaccine clinics in the shelters, trying to get people their boosters, but we're also seeing a lot of individuals get their first dose, so starting their vaccine series, which is a great sign too, in terms of protecting the community when there are outbreaks and when they do get COVID. one last reminder is that isolation and quarantine times have shortened for the general population, but that does not apply to the congregate community, staff or patrons or residents. So we are still doing a 10-day isolation for people who are sick or test positive, and a 10-day quarantine for people who are exposed and are not up to date on their vaccinations. So there's several shelters on here, but for the non-shelter but homeless service providers who are here, if you have staff who are entering into the shelters to provide services, we do ask that you have them follow that 10-day rule rather than the 5, and that's because there is still a possibility of transmitting after those first 5 days of the infection, and we're really trying to do as much as we can to reduce COVID in the shelters where there's so much risk of transmission. That is kind of the general update from us. Happy to answer any questions. I put my phone number and email in the chat so can take questions that way too.
Hey, Kira, this is Robert. For those outside of the shelter system, Kylie used to be the point of contact for those referrals for isolation. Who do we contact now? And then I see Kylie on the line with Chaz behind her name. What is she doing now?
Well, so that phone number that you have saved in your phone as Kylie is still operational. I will put it in the chat. I think I have it memorized. That phone is now being answered by Mackenzie Driscoll, who is on this call. She is our hepatitis C coordinator and is doing all of the coordination for isolation at this time. So keep that phone number. It's still that once we hire a new homeless outreach coordinator, that phone is going to go to that individual because that is a very popular phone. I can let Kylie introduce herself if you want.
Kylie, tell us what you're doing.
Hi, everybody. My name's Kylie, and I used to work at the health district. Now I work at Chaz, and I'm the health equity manager. Still working with community members experiencing homelessness and homeless providers, but just expanding a little bit more. And really looking forward to having Chaz at the table now to talk a little bit more about services we can provide to the homeless community. Thank you.
Thank you, Kylie. Kira, Jason put a question in the chat. I don't know if you can answer it, but he says, was the $33,000 spent for biohazard cleaning at the end of the convention center warming center at the direction of the regional health district? Was it to ensure COVID did not spread? Do you have any idea on that question?
I cannot answer that for sure, but I do not believe that came from the health district.
Do you know if there a person Jason could direct the question to at the health district?
It would not probably be at the health district. I think that would probably be a question for the city.
Oh, okay.
I think Jen may, sorry, Jen, if you don't want me to direct this to you.
Yeah, no, I think that's fine. Jason, you can reach out directly to me on that if you'd like. My email is, I'll put it in the chat, but it's jcerecedes@spokanecity.org.
Okay. Okay, yeah, Eric put that he'll need to check on that too. Anything else for Kira? And by the way, welcome Kira, and we miss you, Kylie, from the Regional Health District. Okay, nothing else for Kira. Karen Stratton, thank you for being here. One of the things that the coalition is doing for the next, at least we're planning to do going forward, is to occasionally invite city council members to come speak to us about their positions, what they're working on, what's going on in homelessness, and from the city council perspective. So Karen Stratton, thank you for being here. Well, what would you like to tell us? I have a few questions for you, but why don't you just start and get us going?
So I've been sitting here worried about my screen because it was messed up and it was all close up. And the minute you started talking, it went to normal. So
oh, you're welcome.
You're the miracle worker. Yes, my name's Karen Stratton. I'm happy to be here. When the meeting started, the Homeless Coalition meeting started at the location on Garland, which they continue, I think, still in person. I used to go to many of those, and then life got busy and too many things on the calendar. So I can almost guarantee you that if council members are invited and they want to attend, we can get council here. This is information that we think we can be helpful with, and we want to be supportive. Just a few updates. The first thing I like to tell people is that despite what perceptions might be out there, that City Council has continuously worked with the administration to help out in this issue. Most of you know that we passed the ordinance in July that kind of laid out the structure, asking the mayor to do many things regarding homeless shelters and, you know, definitions of not just cold weather, but smoke and heat and that kind of thing. We followed up in January 2022, just recently, at the closing of the convention center, again, stepping forward to say we need to get something going, because it was 17 degrees, I think, the night that the convention center closed, and there was no shelter for people. So we continue to be involved. The mayor asked every council member to provide at least 3 locations of places that might serve as a warming center. We had council members driving all over our districts, trying to find locations that we thought Eric and others could take a look at to see if they were viable. I believe that work continues. I have heard that there may be a location for a shelter, but that's all that we've heard. So it sounds like Jen may have an update. So that would be great. We do have the ARP, Council President Beggs has a council committee of members from each district talking about that money and waiting to see what the plan is so we can fund it. We've been very supportive of funding programs as they come to us. One of the things that I'm particularly interested in is, as we talk about shelters and the options that might be out there and the locations, and you find one and then you have a neighborhood that rightfully so is nervous and they don't want this in their neighborhood. I want everybody to know that Councilmember Cathcart and I have been working on what they call a good neighbor agreement, and other states do them all the time when they have shelters in close to business districts and neighborhoods. And we're continuing to work on that, because what we saw in a certain neighborhood in my district was that there was going to be a shelter. It was the mayor started these good neighbor meetings and people were participating, and the neighbors, and then everything stopped. The meeting stopped and the neighborhood was just kind of left there. And so we've really tried to work with Salvation Army's been great. The neighborhood has been great, Emerson Garfield, but we're really looking at trying to find just that right agreement where businesses, neighborhoods, and those nonprofits who are helping provide resources to homeless can communicate and can catch problems before they happen or get worse. So that's something that has been on my priority list, along with Councilmember Cathcart, for the last several months. We're glad for Eric Finch. I think Eric kind of saved CHHS earlier when he stepped in, and I always take a moment to publicly thank him. He's been great to work with. Let's see, I think one of the other council conversations that we've been having is that we would like to see this be a permanent, this search now for a building. We would like to see it be a permanent location, a building that the city purchases. I'm not sure if that's the case. They may be doing a lease. The other thing that I will touch on because I do, and people, if you've heard my spiel, you're going to get sick of me. But what I have been harping on in City Hall is that I don't think sometimes when we have the administration and council level discussions about this topic, I don't think that we are inviting the right people to the table. And by that, I mean, we really need to be working with our universities, our colleges, our hospitals, and healthcare. I would love to see the city administration around a table with UW, WSU, community colleges, all of those colleges at the U District location, where we could talk about, I would love the Jensenberg building. I wish that I was a millionaire and I could buy the Jensenberg building, because to me, to have a one facility that the community could invest in, higher ed, hospitals, city, and have a one-stop wraparound resources that we could bring in dental students. I mean, I sat in emergency one night 2 years ago with my mom, and there was this elderly homeless man next to us that we were visiting with. He had been sitting there all night. He needed to get a tooth pulled, and he'd been sitting there all night. And it's like, we should have those services wherever we decide to place a resource and a homeless shelter. So that would be my dream, is that we have, you could use the community colleges for job training. You could use the nursing students, the doctoral students. There's so many things we could do. And so I hope as we continue down this journey and we join hands and try and come to a place where we're compassionately helping people the way that we should be, that we start looking at a bigger picture of community and not trying to hide the issue. I get crazy when I hear people say, well, we're going to put it out at, Airway Heights. I think it's an issue that could be a community project. And I think that if we could connect it to higher ed and to other resources, and you have faculty that can do research. We have no data. And that's another big problem. There's just not a lot of data. I know Jenn is going to hit that head on, but it would be great to kind of start looking at a bigger picture where we're not always in an emergency situation trying to put a Band-Aid on it. And then next year we're going to fix it for, forever, because that's all we've done. This is my second term as a council member. That's all that's been going on, is we put a Band-Aid on it, we move on. But I think this is an opportunity for people to come together and really look at what we want to see in this community and how we can maybe flip the appearance of, this is a compassionate community, and what can we do with all of our resources to come together to make a difference and to show the rest of the country that you can do some great things when you kind of think outside the box.
Yes, I have a question for you. This
Sure.
is Robert again. Going back to the Good Neighbor Agreement, what topics are generally covered in a Good Neighbor Agreement? How many participants have to agree in a Good Neighbor Agreement? Then my second question is, are there some city council members that plan on attending the COC retreat that's coming up?
Yes, I believe we have council members that are planning. We got the invitation, and I was actually going to talk to Ben Stuckart to make sure that was an invitation. It was, if it was okay if I came. So yes, you'll have city council members showing up. With the Good Neighbor Agreement, what we learned is that the biggest thing is security and policing. And so, having phone numbers, just that simple thing of having a neighbor or a business having phone numbers, that they can call if somebody is in their front yard, or if there's a situation where they're frightened, that they can call. It's also creating a direct link to the police department or navigators, the homeless navigators that we could get available to help out. And it's also connecting with the actual organization that is sheltering. And so that they know, I know there was so much going on in Emerson Garfield that when we finally kind of got to that place where they did have numbers, I think things settled down, that they were able to call somebody at the Salvation Army and say, hey, this isn't working, we're nervous. We've had businesses there that were having some issues that while Candace and I jumped in last year and tried to help connect people, I think that after a while that kind of calmed down. We have the Salvation Army now that is going to the Emerson Garfield neighborhood council meetings. So it's just making that connection. And I mean, eventually, I would love to see a neighborhood, if a shelter is settled in a neighborhood, I think, if we did this right, we could have people in that neighborhood wanting to volunteer, kind of wrapping their arms around it and saying, hey, this is my community, what can I do to help? So there's a lot of things that we've learned about the Good Neighbor Agreement. We're still, kind of playing wordsmithing one that we want to bring forward. And the other issue would be that I think the biggest is the security and having some kind of a clause that you have to have security 24/7 available to take care of situations, whether it's at 3 o'clock in the afternoon or 2 o'clock in the morning. So I hope that helps.
Yes, and aside from those connection and network, I mean, you have a coalition that's around 1,500 plus members of a great networking platform. But what type of education is provided to these good neighbor agreements when developing these discussion points and establishing these connection points? What education specific to this population group is provided?
Right now, I mean, it's just been Councilmember Cathcart and I doing research and looking at what other cities have done in their cities. So I don't even think that answers your question. But if you want to, I mean, if you have ideas or input to help us, it would be great, because it's just the two of us and we've kind of opened the door and thought, let's look at these and let's see what kind of resources we need to include in a good neighbor to be helpful not only to the organization but also the neighborhood, that everybody is covered in it. That's really what we're trying to find, that nice balance. So if you can help us, you know where to find me.
Mm-hmm.
Thank you very much.
Karen's open for assistance.
Yes.
Karen, there's a couple of things in the chat. I'll just read them off to you. Homelessness is in every neighborhood, so why shouldn't shelters be in every neighborhood? There's one. Let me go to another one here. Having the homeless at the table should be a priority, so you can hear straight from those impacted on what their needs and recommendations are.
Yep.
Let's see. Do we have crisis responders? Oh, okay, that's a thing. What is City Council and the Mayor's administration doing to address the many empty buildings, both residential and commercial, that put blight on our city? They aren't being utilized for any purposeful reason. There you go. I think those are the ones that I think we're kind of in there for you.
Well, as far as the buildings, Jensen Bird, if anybody wants to buy it and give it to me, I can take it from there. I agree. I mean, there are so many buildings. And in fact, one that I sent into the administration was the old Ball and Dodd Funeral Home on Monroe. It's smaller, but it's on Monroe. It's on a bus route. It's close to downtown, close to services. And so that's what City Council has been doing, is looking at some of those buildings and bringing them forward. I'll be very blunt because that's kind of who I am. We look at all those buildings downtown and surrounding downtown, and all we hear is, we've got to get this, this is not a problem. We don't want it in downtown. This is not a problem we want to see in downtown. I disagree with that. So yeah, it's a huge issue. And we go back to the not in my neighborhood. And we have got to find a way as a community. I just did a ribbon cutting up at Transitions, the 24 cottages or 22 cottages they built in my district for homeless women and children. And for the 3 years that we worked with Edie, the executive director, to get those cottages built, Edie was a big believer in including the neighborhood. including the future residents in all meetings. And so that was very successful, but it was a battle to every step to make sure that people felt comfortable, that we listened to the concerns of the neighborhood, that we listened to the concerns of the individuals that were going to be living in some of those units. And it's been successful. It was challenging, but now you can drive in that neighborhood. They've just installed solar panels on their roofs. And then we had neighbors that came to the ribbon cutting. It can be done. I think it's just going to take people and strength, dedication, and making sure that we're talking to everybody and that we're not making decisions in a vacuum.
Okay, thank you, Karen. It's 10:30. I think we've addressed pretty much all the chat questions, I think.
Okay.
Any final comment you have before? What I'm going to do, well, let me set up what's happening next. So Karen will give a chance to say anything finally that she wants to say. Then I'm going to leave the meeting open for anyone that wants to make announcements. At the end of our meeting, we usually do that. And normally when we Zoom, I keep it open for a long time just to discuss stuff, but I'm sorry, I've got something else booked, so I can stay around for a little while and keep it open. But mainly we'll just have some announcements and then we'll probably wrap it up. So Karen, final comment from you.
I just thank you for allowing just some time to talk. And I really hope that we can continue discussing continue these discussions, not as adversaries, that we're all in this together. And I've had so many people that will point at city council members or point at me and say, you really don't care. And it's like, we all care. And we all want to do the right thing. And if I could write a check tomorrow for ARP money, I would do it. But it's a crazy process that you have to go through. So it's slow getting through. But my heart breaks every time, we hear or see what's going on in this community. It's bad. It's worse than I've seen it. And the city has not done a great job stepping up. And we feel badly about that. I want people to know from me, I experienced homelessness in my family with my brother, who was a Vietnam vet. I take it very personally and I take it very seriously. And we will continue to work. If anybody wants to call and meet, if you want to call with ideas, please do, because we're willing and we want to see this problem at least a place for people, a safe place for people where we can provide good services and keep people safe and healthy. So please feel free to call anytime. And if you need to talk to another council member, let me know and I can hook you up.
Okay, thank you, Karen. Thank you.
Thank
for joining us today. Okay, for announcements, what I suggest, if you have an announcement, put the raise hand thing and I'll call on you as we go along. Julie Garcia, I know you have an announcement. Haven't you done something with a building nearby? Wouldn't you like to tell us about that?
Hi, Barry. I wanted to let you know that Jules Helping Hands operations is open. Our address is 1819 East Springfield. This is a one-stop place for people experiencing homelessness. They're able to pick up their supplies, get food, meet with their providers. Eventually it will have laundry and showers, and they can come inside and get warm for a while. So again, this is a community building, so anybody, any service provider who would like to meet with clients here can. It has an open conference room that can be used by any members of the community. This conference room has a sound system, lighting, Zoom availability, and we opened it up to the entire community because we know traditionally nonprofits don't have a lot of money for these kind of things. And a conference room isn't something that we utilize in what we do on a regular basis. So we fixed it up and made it available to the community.
Okay, thank you, Julie.
Thank you.
Other announcements? I don't see any raised hands. What? Come on, you people. There's things you want to let us know, isn't there? Wow, I guess not. Well, then I can hang around for about 10 minutes if somebody just wants to. Oh, Sherry Gachitano, tell us something.
Hi, everybody. I'm Sherry. I'm with Spokane Valley Community Advocates, or SVCA. And I just want to let you know that we are opening up. We have a REACT, Rapid Response Network, for immediate acute needs of our fellow neighbors out here in the greater Spokane Valley. And we are looking for community members to sign up to be part of that network. So when a call goes out or text goes out for a particular need, we have a set of community members that have signed up for that. And you can go to our Facebook, and our website should be launching in the next week or two, and the forms will be on there as well. And I put that in the chat.
Thank you. And again, just to repeat, if you just got in here, I will capture the chat and I will send it out on the listserv. So any of those names and numbers are in there. You'll have access to them probably within the next 24 hours. And I'll put the recording of this on our coalition website, so you can also watch the recording. Chris Jackson, you got your hand up.
Yeah, I was just going to say that the Homeless Connect, as everybody knows by now, has been moved to March 1st. So far, we are still going on with that, I'm hoping. And if anybody wants to volunteer, you guys can contact David Stone or go to the webpage on our social media pages. We still need lots of volunteers, and it's going to coincide with the last day of the point in time count. So we are still going forward as of right now. So just wanted to throw that out there for everybody.
Thanks, Chris. And I'll throw out a plug for the point in time count. If you just go to the city website and type in point in time, they are signing volunteers up for that. And they still have openings for the point in time count. Anybody else?
Can I just throw out that the city of Spokane Valley, with our new homeless and housing coordinator, Eric Robinson, is working on collecting volunteers for out here. You can check with Spokane Valley Partners about signing up to help, I think is the contact point at this time. And we do need volunteers out here because it matters that we're counted as well.
Yeah, and I think just to make my comment, the city website is for the whole county. It's so at least that's one place you can go. And there are the CHHS department has a staff person who's coordinating the point in time count. And so that's why it's on the city website, but they're getting volunteers to cover the entire county. And they've got it's a huge task with a lot of partners helping out. Other announcements, comments? I can hang around about 5 more minutes. Anybody want to tell us something interesting for a few minutes? Or are we done?
Hi, can I make an announcement really quick? My name is Megan Vincello, and I'm helping out with the point in time count this year with the city of Spokane. I'm going to put my email address in the chat. We are still looking for volunteers, but we're also looking for volunteer leads. So this year we're going to try to collect people in smaller groups. So we're not asking anybody to go out individually, and using the expertise that we already have in our community as kind of guiding some of these volunteers who have never worked with this population before.
And tell us again the dates. I think you're probably set for the counting the votes in shelters. When is the outside count? That's probably where you need the most help.
Right. So our first day of the count is February 24th, and that's going to be the sheltered count. That evening starts the unsheltered count, and it runs to March 1st. So March 1st, we will be coinciding with that Homeless Connect piece still, which I think is super important. Instead of what it was, the inception was beginning, it was going to be the beginning of the point in time count. This way it's the end, and I think it's going to work fabulous. They're totally on the ball with that. And yeah, so if anybody has any questions, what I'm going to do, I'm an intern with the city, but I'm helping out with the point in time count. I'll put my email in the chat, and any of you can reach out to me if you're interested or you have any questions.
Great, thank you.
Yeah.
Becky, you got your hand up.
Right. I've noticed through the chat, and I've noticed several of you mention how you are interested in being involved. And I just wanted to point out that as the League of Women Voters, we're involved in a little different way. We're involved more on the legislative side. And if any of you are interested in ever joining the League of Women Voters, we are nonpartisan, but we work really hard. We've met this past week with our representatives throughout our area, pushing for homeless the bills that we support. We are currently supporting 14 housing and homeless bills within the state. And so we are working hard with our senators and representatives on funding. We are talking about 500 million, I think it is. I'm sorry, the numbers have escaped me, for to be put into housing. So we're working really hard, and we would welcome your participation if you would like to be involved on the legislative side. And so that's my plug. And just a little caveat, we are thrilled that we're going to be able to meet with the governor next week as our group. We represent about 120 individuals within the Spokane area. So we're working hard locally, and I know Karen's shaking her head because we have been bending her ear a lot lately, and we try to do that on a regular basis. So please look for our website. It's lwvspokane.org. And we would welcome any involvement. Thank you.
And I think Becky's comment is kind of like in parallel with Ben Stuckart about how, lobbying the legislature, because there's a lot of money there. And if you're looking for effective way to use your time, a few phone calls to a few legislatures or going on to a few Zoom meetings with legislators can make a difference in millions of dollars. And Becky's shaking her head because she has seen that happen. I've seen it happen too. So if you're interested, contact her. Anybody else? Comment, announcement, something? Well then, I think we're done. Thank you, folks. Thank you for being here. See you next month. I think we'll be Zooming again next month. The leadership team will discuss it. I think that's our plan, to Zoom it again. And I'll stick around here till people sign off, just in case there's something else there, but I don't have anything else. Okay, well, I'm ready to close her down, folks. Thank you.